Joint problems are the #1 reason people apply for Social Security disability, and every day that I do disability exams, I see people with joint problems. I've had several viewers request that I do a video on joint problems, which I appreciate, so that's what I'm going to talk about today. Hello, I'm John Foster. I'm a medical doctor who does Social Security disability exams, and as usual, everything I say reflects my own opinion based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. Now, I will not be talking about spinal joint problems because the spine contains the spinal cord and the spinal nerves, and spinal problems often, but not always, involve nerve problems as well. So I'm going to be talking about the other joints, the shoulders, elbows, wrists, hands, hips, knees, ankles, and feet. And I'm going to be talking about the different types of joint problems, what Social Security is looking for in a joint problem disability case, and how to present your disability case the best way possible to increase your chances of being approved, and common mistakes I see people make when they have a joint problem disability case. So first of all, the most common joint problem is what we call osteoarthritis, and that's wear and tear on the joints that happens with age, that everybody who reaches an advanced age will have, but some people get it much earlier and more severely than others. The next is inflammatory arthritis. This is where the body's immune system causes inflammation in the joint that damages the joint. And this can be an autoimmune problem where the body's immune system attacks normal joint tissue, such as in rheumatoid arthritis or psoriatic arthritis, or it can be an infectious problem where bacteria, germs get into the joint, and as the body fights the bacteria, that causes joint damage. There can be traumatic arthritis. Trauma or injury to a joint can damage the joint, and especially its cartilage. And bones heal up well. Most fractures heal up pretty well. But cartilage, the smooth Teflon-like lining of the bones in a joint that allows the bones to glide smoothly, does not heal up well at all. And fractures that go through the joint are notorious for causing arthritis in the years that follow. Finally, there are what are called Charcot joints, named after the famous 19th century French neurologist Jean-Martin Charcot, which is damage to the joints caused by overuse when the joint cannot feel pain. And this is most common in the feet and ankles of people who lose the feeling in their lower legs, typically at present due to diabetic neuropathy, although when Charcot was practicing, it was most commonly due to syphilis, a venereal disease that was not treatable at that time, but now is easily treatable with penicillin. Now, Social Security will not approve an application for joint problems based on the diagnosis alone, no matter what the diagnosis is. And also, Social Security will not approve a joint problem disability application based on pain alone, no matter how severe that pain is. They post that directly on their website. There has to be more. Social Security looks for 4 things when it comes to a joint problem disability application. First of all, is there joint pain and or stiffness? And if you have joint pain, you must say so. So many times I'll get a patient at a disability exam and ask them to tell me about the problems that are making them disabled, and they'll say, my knees. And I'll say, well, tell me how your knees make you disabled. And they'll go on and on and on and never tell me if their knees hurt. And finally, I have to ask them, do your knees hurt? And then they look at me like an imbecile, and I should have read their mind and known that their knees hurt. Well, here's the thing. Doctors that do disability exams are not supposed to guess, and astonishingly enough, we cannot read your mind. So if you have pain in a joint, you must indicate that. The next thing Social Security looks for is either abnormal motion of the joint can move in a way that it shouldn't, instability, which basically means that the joint is wobbly, or immobility, which means that the joint doesn't have a full range of motion. The third component Social Security is looking for is signs of an abnormal joint. And those can either be signs on the doctor's examination or signs on imaging. And the common methods used to image joints are X-rays, CT scans, which are a fancy form of X-rays, and MRI scans. For most joints, X-rays do just fine. The exception is the shoulders. In most shoulder conditions, an MRI is better than X-rays. X-rays show the bones very well, much better than an MRI shows the bones. But X-rays do not show what doctors call soft tissue, the muscles, ligaments, tendons, and cartilage in a joint. An MRI is very good at showing soft tissue. So X-rays are good for everything except the shoulders, also the spine, and for the other joints, usually X-rays are fine. Social Security may order X-rays of your joints, which they will pay for. You don't have to pay. They will not order CT scans or MRIs. Finally, the fourth component is, does the joint problems cause impairment of use of the arms or legs? Do you have problems doing work-related activities, which can include sitting, standing, walking, bending, stooping, squatting, lifting, carrying, pushing, pulling, and handling objects and fine manipulation? And also, is there need for what Social Security calls an assistive device, which are things like a cane, crutches, walker, rollator, scooter, or wheelchair? And here's an important thing. If you use an assistive device and you're scheduled for a Social Security disability exam, please bring the device. I've had multiple patients show up for their exam, tell me that they have a cane or walker at home, but they didn't bring it. When a person uses an assistive device, Social Security wants the doctor to see how they do without it and with it, and indicate if it's medically necessary. And if the person has left their device at home, there's no way I can do that. Also, there is a popular misconception that I've even seen in some attorney disability videos that the device has to be prescribed by a doctor. That's not true, and Social Security has it in writing on the website. You can purchase your own assistive device without a prescription from a doctor, and if it's necessary, that will count in your disability application. Now, because Social Security won't approve a joint problem based on diagnosis or pain alone, you must be able to give a good explanation on how your joint problems limit your ability to work. And you should begin by putting this down in detail on the Form 3373 that you fill out when you first apply for disability. And a big mistake I see so often is that people will put down something like, the medical condition is arthritis in the knees, and then when Social Security asks about how does your condition limit your ability to work, they'll say, I have pain because of my condition. Well, that's not really helpful. One of the things to realize is that Social Security personnel are overworked. Also, they had a lot of turnover during the pandemic, and many of the employees are new and not experienced. Because they're overworked and have a big backlog of cases, you're not going to get a doctor going through every word of your hundreds of pages of medical records, or a nurse doing the same. They're going to be skimmed through. You want to present the important facts clearly and make the job easy for the Social Security person who's reviewing your case. Make it easy for them to approve you. In order to do that, you must clearly indicate how your problem limits your ability to work. Here's what I would like to see as an example for someone with arthritis in the knees. They might say, my knees hurt all the time. My doctor has told me they have arthritis. I can stand for about 15 to 20 minutes maximum, and I can walk between 100 to 200 feet. If I stand any longer or walk any further, the pain is so severe that I have to sit down with my legs up for 2 to 3 hours and take my pain medication, which makes me groggy and forgetful for the rest of the day. That's a clear explanation of how the knee arthritis limits the ability to work. And I almost never see such a clear explanation. You can add extra pages to Form 3373, and I strongly suggest you do so and spell out in detail how your joint problems limit your ability to work. And you should do the same thing if you go for a Social Security disability exam. Many people with joint problems in the legs have falls, and if that's the case with you, it's important to point this out. Having frequent falls means that you can't, for example, work on a roof or on ladders or scaffolds or near dangerous machinery. And it may be the reason why you need an assistive device, such as a cane or walker, to keep you from falling. So falls are important. Another factor which I think people often overlook is side effects of medications prescribed for joint problems. Two groups of medications frequently cause work-related limitations. Those are narcotics or opioids such as hydrocodone and oxycodone, and muscle relaxers such as cyclobenzaprine or methocarbamol. Both of those classes of drugs frequently cause drowsiness, forgetfulness, trouble focusing, and trouble staying on task, all of which Social Security considers important for your ability to work. So if you have medications that you take frequently that cause side effects, be sure to mention that. So now that I've talked about what to do for a joint disability application, I'm going to talk about what not to do. And the first thing to not do is to do not exaggerate. And a common exaggeration I hear is a person will tell me that all their joints hurt. I've heard that many times and it's never been true. Consider this. You have 3 little bones in the inner ear of both of your ears, and those bones have 2 joints. You also have a joint on either side of your larynx or voice box. If all the joints in your body hurt, that means that both your ears ache and your voice box hurts, and that's never the case. You may have multiple joints that hurt, and if that's the case, indicate which joints, but don't say that all your joints hurt. The next thing is, having had joint replacement surgery doesn't mean that you're disabled. In most cases, joint replacement surgery works out well and the person winds up more able than they were before this surgery. Occasionally things go wrong. Often there was no way to prevent that. Complications can include the artificial joint being loose or infected, and I've seen bad problems with both. But just having had joint replacement surgery will not qualify you for disability. Likewise, having had bone fractures, including bone fractures that were treated surgically with implantation of orthopedic hardware, plates, rods, and screws, does not mean that you're disabled. In most cases, these fractures heal up well and the person is left in pretty good shape. And in most cases, the hardware is left in permanently. Again, things can go wrong. From time to time, I see things that have gone seriously wrong, but merely having had bone fractures, including bone fractures that were treated surgically, will not get you approved for disability. Something that will help is a specialist opinion, and there are 2 types of medical specialists you might want to get an opinion about your joint problems. The first is a rheumatologist. Rheumatologists deal mostly with the inflammatory arthritis types, such as rheumatoid arthritis or psoriatic arthritis. The other specialist is an orthopedic surgeon, and orthopedic surgeons, as the name implies, mostly deal with surgery for joint problems. Remember, Social Security likes specialists' opinions. They regard them as more important than your family doctor or internist's opinion. Finally, do not, I repeat, do not pretend or exaggerate during your exam. You must maintain credibility. Let me explain why. It's easy for a doctor to make a report on someone who's completely honest and has clear signs of joint problems. It's also easy for a doctor to make a report on someone who's clearly pretending and doesn't have the joint problems they claim to have. The most difficult type of patient, and I saw one last month, is a person who has clear signs of joint problems and at the same time clear signs of pretending and exaggerating. In such a case, it's impossible to tell what's real and what's not. And in such a case, I indicate in my report that this person has signs of joint problems and they have signs of pretending, and I can't tell how bad they are. And as you can expect, their chances of being approved are quite low, and they might have been approved if they'd simply been honest about the joint problems they do have. Well, I hope this has been helpful, and as usual, always remember, if it happens, it's possible.